Hello, this week we're going to talk about Chapter 3. Chapter 3 covers more of the finer details with reimbursement. Let's have a quick look. So, when we talk about government-sponsored healthcare programs, we're talking about things such as Medicare, Medicaid, particularly as it relates here in the United States. We'll be discussing the different government-sponsored healthcare programs. We'll talk about the history of Medicare and Medicaid programs here in the US, going back to 1965. We'll talk about cost-sharing responsibility for Medicare. And we'll talk about the effect that government-sponsored healthcare has on the US health system, which is substantial. Medicare was started in 1965 under Title 18 of the Social Security Act. It was implemented starting in 1966. And the beneficiaries are anybody age 65 or older, or people with permanent disability, or patients with end-stage renal disease. This is where it gets confusing for some people, so this is a very important point here. When we use the term Part A, this is the entitlement. This is what people pay into. This is the hospitalization insurance that people need to sign up for when they turn 65. Part B is a voluntary supplemental medical insurance that you do through a private company, and this covers things that are outside the hospitalization cost. Part C, sometimes referred to as Medicare Advantage, are managed care programs. The Blue Horizons, Kaiser Medicare Advantage. And basically this covers parts A and B, and perhaps D, which we'll get into. D is outpatient prescription coverage. So you can see here with Part A, the hospitalization, this is when we say entitlement, this means it's provided with no premiums once you sign up. However, having said that, there is some cost sharing. This includes both deductibles, co-payments, and co-insurance, as you can see in this table. So the benefit period for hospitalization for the first 60 days, the beneficiary is responsible for $1,489. And days 61 through 90, $352 per day, and 704 from days 91 to 150, and so on. And you can see here the different cost depending on the facility, the benefit period, and what the beneficiary is going to be responsible for. Medicare Part B is voluntary. In other words, people don't have to have it. It is voluntary in the sense that you sign up for it and you pay a premium like any other type of insurance. Cost sharing also includes deductible, co-payments, and co-insurance. Some of the things covered under Part B include the physician services, outpatient hospital services such as the emergency department, and medical supplies. None of these services are covered in the Part A. Please review Table 3.2 for coverage and beneficiary responsibilities for Part B. Part C, commonly referred to as Medicare Advantage, is a managed care product. And basically what happens is it combines both Part A, the hospitalization, and Part B. Many Medicare Part C plans also provide some Part D coverage. These plans require a premium and have cost sharing involved. And again, these are typically things that are out of Medicare managed care products. So companies such as Kaiser Medicare Advantage, Pacific Source, Moda, all of these are examples of the Medicare Part C. Also included in Part C are custodial care, dental service, vision, health and wellness services, and others. The coverage and the premiums will vary depending on the plan and the managed care company that the beneficiary is enrolled in. Part D is outpatient prescription drug benefits, and basically this is a Medicare plan, right? And it has the coverage gap for some medications. Many medications, as we know, are very, very expensive, and this is one way of filling this gap, sometimes referred to as the donut hole. There are other different supplemental insurance that you can cover that pick up the slack on some of these things, the co-pays, the deductibles, and what have you. These are called Medigap plans, and they're regulated by the federal government. Medicaid is different than Medicare. While Medicare looks to cover patients over 65, the disabled, and end-stage renal disease, Medicaid is intended to cover individuals and family with low incomes and limited financial resources. This is a joint program between the federal government and the states. So it's federal money that gets passed on to the individual states, and they can offer these different types of plans. Eligibility, coverage, co-pays, and covered services will vary from state to state. Some states also offer a Medicaid managed care option. For example, in Kaiser, California, they offer a Medi-Cal, as we like to call Medicaid in the state of California, managed care product. Medicaid must provide coverage for the following: poverty-related infants, children, pregnant women, and other newborns, low-income families, families receiving transitional medical assistance, adopted children, foster care children, children that are aging out of foster care, elderly, disabled, and disabled individuals who are receiving Social Security, right? So you can have patients that have both Medicare and Medicaid, certain working individuals that meet disability requirements, and other low-income Medicare enrollees as specified low-income Medicare beneficiaries. The PACE program is a joint Medicare-Medicaid venture. We'll be hearing more about PACE in the years to come. What PACE does is give the states the option of creating a managed care option for frail, elderly populations within their state. Right. And the idea is that the patients live in their own homes, and you have this managed care type of product that helps keep the patient out of the hospital and manage an appropriate level of care, preferably from home. The CHIP is somewhat similar. It's another combination of federal, state monies that target the growing number of children that don't have health insurance. There are almost 10 million children in the CHIP programs here in the United States. TRICARE is yet another government-sponsored program, and this covers active duty members of the military and certain qualifying family members. This also extends to National Guard and military reserve members. And this gives some sort of comprehensive coverage and includes things in nearly any type of healthcare delivery, including outpatient visits, hospitalizations, preventative care, and others. And again, there are different variations on TRICARE, as you can see here, the prime remote, young adult, reserve, retired, and these may have different coverage levels. And that's all I have for you. We'll see you online. Bye now.